Now, over 60 doctors have died in Italy while fighting the coronavirus outbreak. Medical unions say they lack the equipment they need to protect them while they work. More people have died in Italy with coronavirus than anywhere else in the world, although there is hope that the number of infections has reached its peak. Mark Lowen has this report.
Perhaps never again in our lifetime will we see Rome like this. The virus is sucking the life out of this country. 3 weeks on, Italy's lockdown is set to be extended today until the outbreak stops killing. They lowered the flags to half-mast across the country to pay tribute. From Florence to Rome, from Italy's south to Bergamo in the north, the town worst ravaged by coronavirus. It is a symbol of national mourning to mark a month that has torn through Italy's heart, the country with the highest number of deaths from the virus and the highest fatality rate. Italians need to feel there's an end to the daily loss of hundreds of lives, to the constant mourning. Medical unions say the huge loss of doctors here, at least 66, shows a failure to protect those trying to cure it.
They worked without the right equipment like proper masks, and they weren't given them. Not enough had been tested. We were completely unprepared. China showed us what we needed to do and we didn't follow it. It's like sending soldiers to war empty-handed, unable to defend themselves. We could have avoided these deaths. Doctors paid for their commitment with their lives.
We developed a valve.
So young, inventive Italians have stepped in to help, using 3D printing to develop a valve that turns a sports shop snorkeling mask into a ventilator. The blueprint has been downloaded for free 1 million times by hospitals in need across the world.
2 days ago, it was my birthday, and I received a message from Brazil in which a doctor says me that 100 people were breathing thanks to my idea, and I was very, very happy. I cannot receive a better present for my birthday.
The healthcare system too is improvising. Milan Exhibition Centre converted into a new hospital with 200 badly needed intensive care beds. Italy is being forced to adapt to this virus, running after it, but still too far behind. Mark Lowen, BBC News, Rome.
Okay, we can now speak to Professor Paolo Pelosi. He's the head of the intensive care unit at San Martino Hospital in Genoa. Thank you very much, Doctor, for speaking to us here on the programme. I mean, frankly, it's been a devastating time for Italian doctors and healthcare workers.
Yes, thank you. I'm here in Genoa, and I'm very glad to share with all of you our experience. It's a very hard fight. But I can say that we are fighting with a very brave, and I think we are learning a lot about the virus.
Tell us what you've exactly learned about how to deal with this virus.
Yes, what we believe is that if you want to fight an enemy, you have to learn the secrets of the enemy, and that's why we started to develop the concept to individualize the therapy from mechanical ventilation to the medical therapy to these patients. And especially we try to identify different lung patterns. We identified that there are not only lung problems, but also vascular problems. And this is not only a disease of the lung, but a disease that may affect different organs.
So with 60 doctors dying as a result of this coronavirus, would you put it down to them not being given the right equipment and protective gear?
I can talk about our experience in Liguria is regarding this issue was not actually a major issue in anesthesiology and critical care. I think that most of the cases reported in Italy are mainly due to those physicians who are on the ground or not specifically related to anesthesiology and intensive care.
So tell us about the situation there in intensive care with you.
But actually, we have almost 70 to 80 patients intubated, and almost 100 to 150 patients during non-invasive respiratory support. So it's a huge effort. In these last days, we observed a decline in the number of patients coming, which is a good sign in our opinion. And I think that it's very important to treat these patients with the same approach, even if different due to the different disease, as we always did in intensive care.
So what advice then would you give to other countries who are dealing with this now?
I give some different advice. First of all, organization of the hospital. What I mean is that what we use is what we call a sort of middle-age castle model. So we created different modes, so different barriers, and we planned a new barrier when one barrier was full. So this is very important in the organization of the hospital. Second, when we gave a lot of attention to the treatment of patients in non-invasive respiratory support outside the ICU in order to also to buy time and not to be overloaded of patients in the ICU. Third, to treat very carefully these patients. At the beginning, we believed that this disease was more or less equal in all patients, while now we learn that there were different phenotypes by using the CT scan of the lung, by using the analysis of the perfusion of these patients. So we discovered that there were also major problems from the coagulability.
Indeed. I mean,
also the role of physiotherapy in this patient, which is absolutely essential.
Doctors and healthcare workers in Italy and across the globe have been on the front line of this. Thank you very much for all your work and for joining us here on the program.
Thank you very much.